Slim Chance Ambulance, you're being paged to 32nd Street North, Wisconsin Rapids for a 52-year-old female patient complaining of chest pain and difficulty breathing.
You know what that means?
What does that mean?
We got call!
Yeah! Slim Chance Ambulance 1, we copy page and we're en route.
Dancing in the moonlight, everybody's feeling warm and bright. The sun shines bright outside. Everybody's dancing.
Slim Chance Ambulance. Hello? Alright. We're Slim Chance Ambulance. What's going on today?
My chest hurts,
Alright.
and it's hard to breathe, and I'm dizzy.
Okay. We're gonna start off with some vitals. Alright, could you go ahead and open your mouth for me? Alright, airway looks good. So you said you're having some difficulty breathing, right? Okay, what does that feel like for you? Like if you could describe that to me.
Just hard.
Okay. About how long ago did it start?
Maybe an hour.
Okay. Does anything you do seem to help make it better?
Laying down, my shortness is worse.
Okay. Due to the nature, do you want a 4-lead, 12-lead right away, or do you want to wait till we get to the truck? We can do a 12-lead right away. 12-lead right away? Yep. Alright. Are you having any kind of pain anywhere, especially with your breathing?
Just in my chest.
Okay. Does it seem to radiate anywhere? No? Okay. On a scale of 1 to 10, can you tell me how severe that is? 8? Okay. And you said it started about an hour ago?
Yes.
Okay. Alright, do you have any allergies that we should be aware of?
No.
No? Okay, are you on any kinds of medications?
Yeah, I have medication for high blood pressure.
Okay. Here's your 12-lead. Okay, nothing too abnormal with the 12-lead. Okay, I'm gonna go ahead and listen to some lung sounds, okay? Alright, so if I could just have you breathe in as deep as you can. Again. Okay. And one more time. Okay, so you said you took some medication for high blood pressure.
Mm-hmm.
Is there any other medical history that we should be aware of?
AFib?
AFib? Okay. When was the last time you had any kind of AFib event?
A month ago?
Okay.
I've got a set of vitals for you,
Alright.
if you're ready for them.
Yep, go ahead.
Okay, so I've got a blood pressure here showing 172/87, a heart rate of 120. She's breathing at 22 respirations per minute. I counted. She's got an SpO2 of 88%.
Okay.
What were her lung sounds?
They were crackles.
Crackles? Okay.
Yep. With her SpO2 being low, I think we should start some oxygen.
Okay.
We can go ahead and start the nasal cannula at 6 liters per minute.
6 liters per minute?
Yep.
Okay. Sounds good.
I'm not gonna put it on you. I'm just gonna drape it over your head. I can edit that. Whatever. Alright. So you alluded to a medication you take for your blood pressure. Do you know what that would be called?
I don't know.
Metoprolol? Is that what it was? Okay.
Okay.
All right. Your oxygen is set at 6 liters per minute.
Alright.
What's going to get you right now? Or do you want us to get her loaded up? What are you thinking?
We can get the patient loaded, the ambulance, and then go under there. Alright, do you think you'd be able to walk with us to the ambulance?
No,
Okay. We'll bring the cot around and we'll get you on it, and then we'll go and get you loaded up.
it's hard to breathe.
Okay.
Okay, now that we got you in the ambulance, how are you right now? Do you want me to sit you up a little bit?
Yes, please.
Okay. Is it a little harder to breathe right now?
Yes.
Okay. How's that? Is that a little better?
Yes.
Okay. If you need anything else just to get you more comfortable, just let us know, okay? Alright. What do you want?
We should administer aspirin at 324 milligrams for 4 tablets of 81 milligram tablets.
Okay.
Orally, and those are the baby aspirin, so you can chew that.
Okay.
And then we can also go ahead and administer nitroglycerin for the elevated blood pressure.
Am I dying?
You're not dying.
You're not dying. You're gonna be perfectly okay, all right?
Alright, here, take these. Alright, there you go.
Myself?
You're gonna chew them up real good, and then swallow them for me, okay? I know they don't taste the best. They say they're orange flavored, but they're not. Okay. And then alright, so you said you wanted 1 tablet of nitroglycerin for a total of 0.4 milligrams per tablet.
Correct.
Okay, so I got that here.
Okay.
Okay,
Looks good.
got 1 tablet. So this one is gonna go underneath your tongue. You're just gonna let it dissolve there, okay? Actually, would we have just put it in there?
Oh well.
Alright, sounds good.
All right, partner. I think we should begin transport to Mid-State Hospital.
Okay, do you want to send a new set of vitals first?
Yes.
Or, okay.
I will do that while we are en route.
You'll do that now?
Yep.
Okay,
And if
sounds
we
good.
could go non-emergent, please.
Non-emergent?
Yep.
Alright, sounds good. Sounds good. We're gonna go en route to Mid-State Hospital.
Alright.
Good stuff.
We're still rolling.
Go, sure. Alright.
Alright, so what I'm going to do is I'm going to go ahead and take some more of your vital signs again, just to see if our interventions have helped at all, okay? Alright, so I'm going to press the blood pressure button, and you're going to feel the blood pressure cuff squeeze on your arm again. And looking at your SpO2, it hasn't come up at all. I'm going to go ahead and listen to your lung sounds again, alright? Alright, so if you get deep, breathe in deeply. Alright, they still sound pretty crackly. What that means is that there's fluid in your lungs. Would you be comfortable if we started you on some CPAP? Might make your breathing easier. Okay. I'd put CPAP on her. We don't have any that's readily available, but I'd put CPAP on, and then put on oxygen at 10 to 15 liters per minute.
A few minutes later.
Alright, I see that your blood pressure went down. Is your chest pain getting any better?
It is.
Okay, what would you rate it on a scale of 1 to 10 right about now?
Maybe a 4.
4? Okay. It doesn't radiate anywhere still?
No.
No? Alright. So what I'm going to do is I'm going to give a radio report to the hospital, and then we'll continue transport, okay? Alright, so I'm just going to call the hospital and give my report, okay? Hello, this is Zach with Mid-State Ambulance. This is Mid-State Hospital.
This is Mid-State Hospital. Go ahead.
Hi there, I'm bringing you a 52-year-old female. She's, chief complaint of chest pain. Upon arrival, we found our patient who had an elevated blood pressure, elevated heart rate, and a low SpO2 with crackly lung sounds. We have administered 0.4 milligrams of nitroglycerin sublingually and 384 milligrams of aspirin orally. We have also placed our patient on CPAP. Current set of vitals is 128/88 for blood pressure, heart rate of 98, respiratory rate of 18, and SpO2 of 95%. ETA is about 3 minutes. Do you have any additional questions for us?
Okay, no questions, Mid-State Med 1. Room on arrival.
10-4, thank you.
Bye.